You're watching the very beginning of a 5-hour revision facelift and neck lift procedure. This is real-time footage, completely unedited, to show the reality of what facial plastic surgery looks like when it's done thoughtfully and meticulously. The first few minutes may seem slow, and that's exactly the point. Surgery like this is not rushed. It's performed with care, with intention, and with a deep understanding of anatomy, especially in revision cases like this one. Revision surgeries are among the most complex procedures in facial plastic surgery. We're working with scar tissue, altered planes, and previously manipulated anatomy. That means everything has to be approached with heightened caution and respect. What you're seeing here is the process of gently elevating the skin, carefully, separating the layers, and establishing safe surgical planes. It might look like not much is happening, but in fact, this is some of the most critical work in the operation. It's during this early stage that we lay the foundation for everything that follows. If we rush or are careless here, we could damage a facial nerve, compromise blood flow, or create irregularities that show later. So instead, we go slowly. We go layer by layer. Each move you see is purposeful. Every time an instrument is placed or retracted, it's done with intention. We're evaluating tension, thickness, vascularity, and scar presence in real time. The revision process often means we're navigating through unexpected adhesions and tissue changes caused by previous surgeries. We can't assume normal anatomy, we have to find it. That's why there's a lot of gentle dissection here. Not just lifting tissue, but reading the face, listening to how the body responds, and staying in complete control. There is no soundtrack, no dramatic music, no time-lapse here. Because the truth is, real surgery doesn't happen in a montage. It happens in quiet, steady movements, in the space between what you notice and what you don't. In this specific case, we're addressing prior scarring in the lower face and neck. The goal is not just to tighten, but to soften the overall appearance and restore a more natural contour. That requires more than technique. It requires patience. As surgeons, we have to balance what's possible with what's safe, and in revision cases, that line is even more delicate. The patient's goals are at the forefront, but we also have to preserve function, minimize risks, and honor the integrity of the face. You'll notice we haven't even begun the lifting yet. That comes much later. What we're doing here is preparing the groundwork, slowly releasing tethered tissue, identifying safe zones, and avoiding critical structures. If this part is rushed, the rest of the surgery suffers, and that's why showing you these first 5 minutes matters. Because this is where the surgery really begins, not with the final stitches, not with the dressings, but here, with slow, deliberate technique. For viewers who are medical students, residents, or fellow surgeons, I hope this footage offers a clear reminder. Precision over speed always. And for patients who may be considering surgery themselves, this gives you a look behind the curtain. It's not glamorous, it's not dramatic, but it's real. And that realism is where trust is built. We want our patients to heal beautifully, but that outcome starts here, with surgical decisions made in the first few centimeters of dissection. Every layer we lift, every fiber we release, is done with long-term results in mind. This is how you achieve natural, lasting outcomes, not by shortcuts or aggressive pulling, but by honoring the structure of the face and respecting its history. Thank you for watching this real-time clip. Whether you're here to learn or simply to understand more about the process, I appreciate your interest. If you'd like to see more content like this, unedited, educational, and honest, consider subscribing and leaving a comment. Your curiosity is what helps us continue to share, educate, and improve care.